Americans may soon be able to allow switch vaccines when choosing a COVID booster. Sources tell NBC News that FDA is expected to sign off on, or could sign off on, this mix and match strategy as early as tomorrow. Some doctors and health officials say the move would help simplify the booster rollout and ensure that people who want an extra dose can get one. New data shows mixing and matching vaccines may actually provide more protection, especially for those of us who got J&J's shot. Right now, U.S. regulators are working to expand booster eligibility to millions more Americans. The FDA expected to approve extra doses of Moderna and J&J's vaccine in the coming days. Dr. Kavita Patel now, former White House health policy director during the Obama administration and an NBC News contributor. Dr. Patel, thanks. If the FDA gives the green light, can people assume that mixing and matching is both safe and effective?
Yeah, Shep, good to be with you. And I think the key here is that the FDA made a nod to this in last week's advisory committee with a presentation of the data and a discussion of the data. But obviously, none of the manufacturers are asking for this. So that's why we're waiting for the agency's language. And yes, Shep, to your point, it does appear, small trial, about 458 volunteers across all three vaccines with mixing and matching, but it was safe and effective thus far. I think it'll be clear, though, that we don't want to create chaos. So we're going to probably see language that encourages for you to stick to what you got, but that if you could, or if you, after discussion with your doctor, wanted to mix and match, and that's appropriate for you, this might be the most relevant for J&J recipients, Shep, then you can do that. What's also confusing is that for J&J recipients, it's 18 and above, everybody that's recommended to have a booster, so far a second dose of J&J. But for Moderna and Pfizer, let me be clear, the boosters are still limited to anybody over the age of 65 and people between 18 and 64 that are high risk or have high-risk occupations, law enforcement, doctors, et cetera, pharmacists. So I think that we're still going to see confusion, Shep, no matter what the agency says tomorrow.
That seems to be a steady. Let's talk about J&J's vaccine. If you got J&J, it's pretty clear from a lot of these tests that your protection goes way down. But it appears, at least with Pfizer and Moderna booster, it could be much greater. Should a J&J person get something else?
Yeah, I will say this, having seen the mix and match data, it feels really difficult for me as a physician to tell a J&J patient that they should stick with J&J when I know that the mRNA vaccines, Moderna or Pfizer, can raise the neutralizing antibody levels from the original J&J dose upwards, Shep, of 75 times.
Wow.
Now, how much antibody do we need? Probably not that much, but I think it's clear that it's better than a second dose. So it does bring up for me in practical patient conversations, yes, an mRNA vaccine might suit you better for that second dose. I know that a lot of my patients are already seeking out, though, Shep. A lot of my Pfizer patients are saying, well, I want the Moderna one. We don't see that much of an incremental difference if you have one mRNA to switch to the other. And I would say that that incremental difference is not worth switching if it's easy to stick with the same manufacturer. But you're hitting it on the point on J&J recipients.
I got one more thing. I've been watching the numbers really closely in the United Kingdom, and I don't understand it. They're very well vaccinated, yet their numbers are going up. Should we be looking at this and being concerned about this side of the pond?
Yeah, Shep, this is something I've been watching closely, and I have a little bit of like a pang in my gut because we're watching kind of a sublineage of the Delta strain, something very specific
Delta
that
plus.
Is growing in percentage. Right, exactly. That is growing in percentage in the UK. And Shep, I think that could explain there's a potential that it's more transmissible than Delta, which makes it easier to be even more infectious than Delta. But I think what's happening at the same time, though, Shep, is this real world experiment where the efficacy of AstraZeneca is decreasing, and they haven't rolled out their boosters.
Yeah.
It's an argument for boosters and a pretty compelling one.
And their number of young people with vaccines is pretty low, too. Dr. Patel, always watching. Thanks so much for the guidance.